Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm chatting with Dr. Anjar Setiani about her upcoming presentation here as the add-on package for the Gold Lactation Conference. Welcome, Anjar.
Hello, Christine.
Lovely to have you here today with us. So, Anjar, where in the world are you? Tell us a little bit about where you are.
Hello, everyone. I'm Anjar Setiani. I'm a pediatrician, IBCLC from Indonesia. Christine, it's a very great honor for me to be a part of Gold Learning Conference this year.
We love having you
Yes.
here.
Yeah. I'm a pediatrician since 2014, and I'm a member of Prabarini Lactation Team, one of lactation team in Jakarta. Um, our team consists of 60 lady doctors, and one third of us are already IBCLC, and our services consists of outpatient and inpatient care about lactation. And we do also frenotomy for tongue tie and lip tie, and helping many mothers to achieve their breastfeeding goals, include Prabarini method for relactation and induction of lactation.
Beautiful. You have quite a big center there with 60 physicians and also who are, you said a third of them are also IBCLCs, correct?
Yes.
And how many families do you serve per year? It sounds like a big place with lots of babies coming in.
Yeah, we have already 15 lactation clinic, which are spread across several provinces in Indonesia, Christine. And in each lactation clinic, uh, there are IBCLC of our team. It could be a doctor, pediatrician, or dentist. And a lot of breastfeeding diets we have for restore their breastfeeding, and for support for still breastfeeding until 2 years, and weaning with love. I think many parents and breastfeeding diets, the exact number
It's difficult to say.
I don't know. Yeah, it's difficult to say. Yeah.
But you're serving a lot of the communities with different centers in Indonesia. Beautiful. Thank you for sharing that. Now, you mentioned the Prabarina method. Your presentation is titled here for the lecture pack, a unique case, the primary amenorrhea and strategies for induced lactation. So you have a special method of induced lactation that you will be sharing with us during the lecture, correct?
Yes, yeah. In this conference, I will present a unique case that we helped in our lactation clinic. Uh, a case about a primary amenorrhea and strategies for induced lactation. By attending my lecture, the participant would learn about the potential etiologies of primary amenorrhea and how to approach to this kind of case.
It's a very specific case. I love that because, some of us might not get to see cases like this very often, but as lactation care providers, want to be prepared for cases like that because it is important to be able to serve the community and in also very unique cases, correct?
Yeah, Christine, great. This is also one of unique case that we help, and actually a lot of cases of induced lactation we help, but this is the unique one because the mother suffered from primary amenorrhea, and in this case, in this presentation, I will share step by step of induced lactation program in the special circumstance of primary amenorrhea.
Wonderful. We're looking forward to that. This presentation is, of course, part of the lecture pack that we have, Unlocking Milk Production, Keys to Clinical Assessment and Management. And you were mentioning step by step, you will walk us through how this particular case was managed. And induced lactation, that is very, it's so needed. It's such a big topic, right? This is a very unique case, but you're dealing with lots of cases in your clinic, right? And it is so wonderful that you do this work. So talk a little bit about induced lactation.
Yes, induced lactation is process that so induced lactation is a process through which non-puerperal woman is stimulated to breastfeed an adopted baby without a preceding pregnancy. So if we know in pregnant mother, the breast is prepared for breast milk production for 9 months. But in induced lactation, in a very short time, we have to prepare the breast to produce the milk. So this is very challenging.
And but you have developed the method, and you are doing this. It's wonderful work that you are doing. You also talked about tongue tie. You're seeing a lot of also tongue tie babies, and you are also doing frenotomy in your clinic. Talk a little bit just about that point as well.
Yeah, we meet a lot of baby with slow in weight gain and even failing to thrive, a breastfed baby. And we checked the oral anatomy that the baby had tongue tie and or lip tie. So we do the screening process whether frenotomy is indicated or not in each case, and we also do the supplementation at the breast supplementation. Our goal is that the baby have to grow normally and have normal development, but the breastfeeding is have to continue until 2 years. So we restore the healthy breastfeeding for the baby.
Beautiful. Thank you so much for sharing that. Dr. Anjar Setiani, before I let you go, any last words for our viewers that you have for us?
Yeah. Hello, good learning participants. Please join us in this year because a lot of update information about breastfeeding you will get. And by attending my lecture especially, I will share a unique case about the primary amenorrhea and how to approach to this kind of case. And I will share step by step of induced lactation program that we arrange in our country in this special circumstance of this case, primary amenorrhea. So see you in Gold Learning Conference 2024.
Thank you so much, Anja. That was lovely having you here, hosting you here today. And we can't wait
Thank you,
for
Christine.
the conference. Thank you, everyone. And if you
Yeah.
would like to learn more for our viewers, go to goldlearning.com, goldlactation.com. There you'll find information about the lactation conference. We get started on April 2nd with our presentation there, the keynote presentation. You'll find all the information there. It's an open access presentation that you can sign up for. And then you can also find out about all the wonderful add-on lecture packs that we have available for that conference, and where, of course, Dr. Anjar Setiani is part of as well. Thank you, everyone, for participating here, and I hope to see you at the conference. Bye-bye, everyone.